Initial thoughts are most welcome, and if I'm honest, I guess slightly unexpected. I didn't expect the Minister to announce all three at this juncture, but she has done. And I'm saying that despite the fact that options A, B and C will be implemented in full, there's a vast amount of work that now ensues as a result of the Minister's decision to proceed with all three. And, since the announcement, there's been a lot of discussion about where the money is going to come from. And I am glad to say that Minister Jack Chambers has been included in the discussions as well, and is fully behind the decision to adopt all the HIQA recommendations. But it's going to cost. It's going to cost a lot of money, and this decision has come, I suppose, at a juncture when possibly the National Development Plan may have to be updated. But either way, there's going to have to be a significant amount of costing done, and indeed the timelines for implementation agreed. And that's very, very important. In the first instance, a site for the expansion of services in the region is going to have to be identified and developed. And the timelines with which that site is going to be developed are going to be crucial in terms of what it's going to, I suppose, morph into over the months and years ahead. And essentially that will be ultimately another hospital with an emergency department for the Midwest.
And just on that, we've heard the Health Minister say that all three options will be pursued simultaneously, meaning that there will be work done on each one at the same time, that no one option is going to be prioritised above another. Do you think that's the right approach, or would you like to see maybe more focus done on those short-term measures before significant progress is made on that long-term development of a new facility?
I think that the way the Minister is planning this is the most efficient and quickest way to mitigate the ongoing risk to patient safety that exists in the Midwest. Bear in mind, option A is already fully funded, and the works that it involves and entails will be ongoing, for many years to come. But in addition, with the expansion of the services within the confines or close confines of UHL, wherever this second site is going to be, will ensure, I suppose, that because it's going to be developed in stages, it will allow early access to basically what is going to be a new hospital. And I suppose, my reading of it is the only viable approach. And it's not just my reading. Bear in mind, there's been significant clinical, managerial, political, and service user input ultimately into the decision that the Minister has taken. And when you see so many people saying the same thing, we've got to concentrate now on the decision that has been taken to ensure that the development on that second site is done in a timely manner, and ultimately the benefits of which will be the service users of the region. And yes, there's been a lot of discussion about location, where this second site is going to be. We must heed the HIQA advice. They're the regulatory authority, and they have advised it must be in close proximity. And you can understand the rationale behind that, because under a shared governing and resourcing model, it will allow for the expansion of services in a timely manner. Were it to go elsewhere in the region, there would be significant issues that would have to be overcome in order for that to be developed. You have to think staffing is also an issue. Accommodation is an issue. So there's a real opportunity as part of this development that joined up thinking basically between all vested interests, not just in terms of development of a hospital, but the staff, where are they going to live? So you have Mayor Moran's office are going to be involved, and Department of Housing, all vested interests to ensure that we're not going to be talking about this in 10, 15 years' time. Not only will you have a facility, or facilities, plural, fit for purpose, with finally we'll be able to say multiple EDs in the region too, but you'll also have the staff to staff it. It's an ongoing challenge right around the country, staffing within the health service and retention of staffing. So in conjunction with UHL, for example, there's a lot of conversations to be had there in relation to undergrad programs and the development of, I suppose, the educational resources in the region, that in 10 or 15 years' time, that not only will you have the facility, you'll have the staff, and those staff will have a place to live. So, there's a lot of moving parts to this. So just because I guess that there's been a significant announcement, there's also a seismic amount of work attached to that announcement. So I'm presuming early in the new year, a development board will be established to oversee what will be one of the largest infrastructural projects undertaken, I guess, in the Midwest in a very, very long time.
In those first few weeks after the Christmas recess and before the next Dáil break, what would you like to see achieved on these measures? Would you like to see timelines, as you've mentioned, or funding commitments? What needs to happen in that space?
Well, the funding commitment is there, but a question of where, basically out of what pot that funding is going to come. More clarity on that. Yes, absolutely, more clarity on that. And the timelines, the implementation timelines. Option B, when it's developed in full, it's a multi-phased approach. So the timelines need to be agreed in terms of the development of that site. I mean, there's going to be a relocation of some of the services currently at Dáil. Urgent development of an urgent care centre. You're going to have adult mental health services. The maternity hospital is a huge issue, and that should be part of the initial phase of the development. Is the relocation of the maternity hospital. That was the advice many years ago, was to co-locate the maternity hospital with, I suppose, in close proximity to acute beds, basically. That hasn't happened, but that will happen as part of this. So the timelines need to be agreed right out through the provision of an additional ED in a Model 3 or 4 hospital in years to come. Now, I say in years to come, this is not going to happen overnight, but it will be done in such a manner that the benefits, as I said, to the service users of the region will be felt in a much more expeditious way than if, for example, option C was developed. If it wasn't developed in unison with option B, it's crucial that any development on a greenfield site in the vicinity of UHL must be future-proofed, must be timelined, must be costed, and that work, I guess, after the Christmas break, when the Dáil recess finishes, that's a body of work that the Department of Public Expenditure will have to undertake in conjunction with the Department of Health, in conjunction with the HSE, in conjunction with all vested interest in this, which I mentioned there, Department of Housing, your cabinet per se, Mayor Moran and his office, and it cannot be understated the significance of the announcement. Only a few short weeks ago, there was a lot of discussion about, will the minister dilute option B? Will the minister, defer any decisions on option C into the new year? It hasn't happened. We've got all three. And now we have an opportunity to build on that in every sense of the word, but it's going to be an inclusive project. It's not something that's going to be dictated to from the outside in. It's actually the people that will use that service, whether they be staff, clinicians, managers, service users, everyone is going to be involved in the process moving forward. That's the difference. In years gone by, you had different factions saying different things. Ultimately, we ended up with nothing, absolutely nothing. This time around, there's been a very much a collaborative and inclusive approach that has got us to this point, which is, it's been recognised by the Minister, in fairness, and her officials. And, let's, I suppose, in another 3, 4, 5 weeks, the body of work that's needed to be done will start. And it will involve a lifetime of commitment for many. Mm-hmm. It's a multi-generational project, but hopefully the fruits of which can start to be felt in the short term. I would certainly envisage at some point next year, towards the latter end of next year, there's absolutely no reason why Assad can't be turned on a site, and within certainly 2 to 3 years, the benefits felt in terms of service provision, but not just at the new site, the new greenfield site, but also in the region in terms of an expansion of services in the community, an expansion of the National Ambulance Service. So it's a multi-agency approach to problems that exist in a very large region.